Hi, I'm Dr. Tieche from Recharge Clinic, and we've reached out via social media and asked for some of your questions. And these questions were pretty much targeted for our IV infusions and our vitamin therapy. And so I was going to go over the questions and then answer them. So the first question I have is, what are the benefits of IV vitamins? Well, there are numerous, but the main one is that it's able to give your body a much higher amount of those vitamins like B12 and vitamin C and glutathione that you can take orally. And for each person, there's kind of a ceiling effect. And what that means is there's only so much you can absorb at a time. And sometimes we need a little bit more of that when we're doing cellular repair or fighting off illnesses or just trying to feel better. So the IV of the vitamins is we can put a pretty high concentrated amount of vitamins in. It goes into your bloodstream and then it super saturates the cells and really drive those vitamins in there. So that's that one. How often should I get a vitamin infusion? Well, that's going to be pretty variable. You know, there's some people when we're kind of treating them aggressively for some stuff, like when we had people who were sick with COVID and were very dehydrated and were really needed a lot of infusion. Some of those people came in every day and got vitamins as well as just hydration, just the plain saline bags. Others, when you're just trying to do it to feel a little bit better, you might do them once a week. Some people, when they're on more of a maintenance, might do them more like once a month. Generally, once you've gotten them, you kind of know when you start feeling a little bit depleted. Other times I would suggest when people get that, it definitely is if they start feeling ill, because that's one of the things that it really helps with. It really helps boost your immune system, so it really helps fight stuff off a lot. So another question is, what if I already take vitamins orally? So I kind of alluded to this a little bit earlier. So almost all of us take vitamins, you know, they help and they are a good thing. But sometimes we can't get enough, and that's the main problem of why the vitamins given this way, we call parenterally, whether it can be in a shot or in the IV forms, work a little bit better because they can get much higher doses of that. And this is particularly true of vitamin C. Vitamin C is one of the cornerstones of the vitamins that we use for treating people because it really boosts your immune system, helps with cellular repair and things like that. And vitamin C has a very low ceiling effect. So in other words, you can take a whole bottle of it, but your body's only going to absorb a small amount of it. The rest is going to pass right through. It's incapable. Once the intestinal receptors are saturated with it, it cannot absorb anymore. So that's really one of the bigger reasons. The other thing is, you know, you might not be taking all of the same vitamins that we give you and some of the micronutrients that we put in there. So it kind of gives you a little bit more balance and kind of boosts all of them up. So there's no problem with taking oral vitamins and getting vitamin infusions. They don't really interact with each other. They don't cancel each other out. The vitamins that we give are all what are called water-soluble vitamins, so that if you were to get too much of them, your body, after all the cells have been saturated with it, would just excrete the rest of it. So they're not fat-soluble vitamins, and those vitamins are a little bit more risky. Along those lines, the next question is, can I get too much B12? Well, everyone talks about B12 and maximizing your B12, and that's really an important thing. B12 helps with so much stuff. It gets depleted under periods of stress, and it's not just stress like emotional stress, it's physical body stress as well. And, you know, really between the two of them, almost every human alive now is under that kind of stress, whether it be work or families and all of this stuff. The other thing is, in our dietary intake, we don't get that much of it, as much as we need. And it's one of the ones that's primarily used in most of the enzymatic reactions. So it's critical that we kind of keep that one up as high as we can. It does help with cellular repair, it helps with fat burning, all of those kinds of things. So that's one of the main ones that we give, both of injections and higher amounts in the vitamin infusions. It really does help pep people up a bit. People feel like a little bit of an energy boost after they get that. You know, you really can't get too much of it. Your level might be high afterwards if you were to measure it, but really in several days it would come back down to the normal amount, because it's, again, one of those ones that you would excrete. Next question is, are more fluids beneficial if I don't feel dehydrated? Well, I guess the answer is, from looking at a lot of people's blood work, I would say the answer is yes. So when we give people IV vitamins, we don't always give them a large amount of IV fluids. We give them a medium amount, usually 250 cc's. That's kind of the average amount that we would get just to get your vitamins. there are some people who are feeling a little bit dehydrated or may want to increase their hydration. People who are ill or running a fever, they tend to be a little bit dehydrated. People who have been exercising a lot, or people that have been working outside in the heat. Regardless of whether you think that you're keeping up with your fluid intake, most of the time those people are dehydrated. And in fact, we see this almost on every blood panel that we do. When we look at people, their labs always kind of indicate that they're a little bit dehydrated. We just tend to run that way as humans. We don't really stay always as hydrated. There are some people who are exceptionally good at it, that always have maybe a container of water and they're drinking all the time. But by and large, most of us are a little bit dehydrated, particularly when we're working. We can't really be bothered with getting up and going to the bathroom all the time, so we're focused on work. We tend to be a little bit dehydrated. Our bodies get used to that. We feel a little bit, we don't feel that same amount of moisture in our mouth, and so we don't have that craving, so we kind of get used to that. So back to the question is, so people are a little bit. Giving people, as long as someone has a normal heart and normal kidneys, giving you a little bit more fluid is not going to hurt. It's just going to fill up all of your cells, fill up your body, kind of make you feel a bit refreshed. It brings up your blood pressure a little bit. And then really, once you've had the excess amount of water or liquids that are in there, you're going to just kind of urinate them out. Almost if you drank too much water. Like, you drink a lot of water, well, all of a sudden you're not going to pee a bunch, and then you're going to start peeing. It's going to get rid of that. So we want to get you that threshold where you almost feel like you have to go, because then we know that your body's pretty much saturated and very, very hydrated. Why do we want that hydration? Well, that's how your body eliminates a lot of its waste. It carries it out in the urine. So if we're kind of staying a little bit volume down or a little bit less hydrated, then those toxins are staying in our body, so they're not getting flushed out the way we want. We really encourage people to drink a lot of fluids when we put them on the weight loss program for that very fact. One, honestly, we know that just having more liquids in your body makes you feel more energetic. And we know that because that's really why people drink coffee in the morning. It's not so much the caffeine, it's actually that boost of liquid in your vascular system that increases that pep. So people who drink a glass of water in the morning feel that same kind of energy increase. So we know that it's going to help you feel a little bit better. It's definitely going to help flush out those toxins. And for people who are trying to lose weight, it kind of fills you up a little bit, so you don't feel that that hunger. So the next question is, when's the best time to get an IV before I travel? So there's a lot of people who like to get vitamins with with more vitamin C in hopes of boosting their immune system. Just, it's been a real common thing around the COVID thing here. People were getting that. But a lot of people like to do it before they travel, particularly if they're going to fly. Because we all know, really, even though we're wearing masks on the planes and being in the airports, we're around a large number of people who all have all kinds of different funks going on. And so we want to protect our body and really make it as strong as possible to ward that stuff off. And then when you're on the plane, we know that they use recycled air. And there's another big area where people get sick a lot. A lot of people get sinus infections or sinus irritation from flying because of the low humidity in there. And then really we're touching all kinds of stuff every place we go. And we try to be compulsive with washing our hands and desanitizing everything. But it still can happen. You may just grab a snack and you've been touching stuff, and then you might be exposed to something. So we want to boost our immune system as much as possible before we travel. So really several days before is probably the best. Anywhere from 1 to 3 days ahead of time, you're probably going to get the maximum impact on your immune system, and then it's going to continue to linger during your trip. So that's what I would recommend. I wouldn't do it too far away because it's probably going to start going down, but you could do it closer, and that's not a problem as well. The next question I have is about NAD therapy and it helping with brain fog and other things like COVID recovery. Well, NAD is a coenzyme. It stands for nicotinamide adenine dinucleotide. That's why we call it NAD, because of that long name. It's a coenzyme that's active in our body. It's very much integral in a lot of enzymatic reactions. It works in our mitochondria to do a lot of repair. The mitochondria is like the powerhouse of your cells. It's the focal area where everything is happening. So it kind of repairs stuff, makes stuff, and so it's really important to be in good quantities there so it can get the cells functioning properly. What else does NAD do? Well, NAD helps repair DNA. So at the end caps of our DNA, there's DNA, and then at the ends of them, there are end caps. And those things are called telomeres. And with oxidative stress, all of the things that we're exposed to in the world, these little molecules come in, these little free radicals, and they break up our DNA. And those are the things that cause our DNA to mutate and cause us to get sick. cancers and things like that. Well, NAD actually helps repair those telomeres and increases the end cap. So that's really an important thing because it really helps prevent disease. NAD has some other functions. It really helps with mental clarity. It really helps with depression and offset a lot of that. And in higher doses, it actually helps with alcohol and narcotic withdrawal. So people who are struggling with those things, NAD has been definitely shown. All of these treatment centers use NAD infusions to help with that. Now, on a lower dose, a lot of people take NAD just for clarity and energy, and it really helps boost that quite a bit. Part of this question is with COVID recovery. This has been an integral part of COVID recovery and COVID treatment. People have been recommending this because we know that virus causes such havoc in our body as far as inflammation and just disrupting everything that NAD levels get depleted. So we want to increase that. One of the long-term problems that people have after they've been exposed to COVID virus and have had the infection, or even we see this with people who have had a bad reaction to the vaccine. There's this thing called long-haul symptoms, and there's a lot of chronic fatigue. And why that is one of the reasons is because NAD levels are low. All the other reasons are, when we check it, people's testosterone and thyroid levels are low. And this is because this is such a massive assault on people's bodies that we are totally depleted. We survived the battle, but now we have to kind of lick our wounds and put ourselves back together again. So NAD is integral in that. It is very safe and makes people feel very good once they use it. And most people that start it never really want to stop it because it feels so good. It's not something that you can overdose with. It doesn't really give you a high or anything like that. It's just a general sense of well-being. The main problem with NAD is it's not an oral version of it, and so people have to either take it by injection or intravenous form. But taking it those ways works very effectively, and it really brings that level up, and people notice a big difference. So these are some of the questions that I had really about IV therapy. I hope they answered some of your questions, and if you have some other ones, please feel free to write in. I'm more than happy to answer them.